I want you to think about something tonight before you turn off the lights. What if I told you that a simple food you can eat right before bed could drop your blood pressure while you sleep, without interfering with a single medication you're currently taking? I'm not talking about some exotic superfood that costs $20 a serving. I'm talking about something so ordinary that you've probably walked past it 100 times in your grocery store. Here's what shocked me as a physician. We spend billions on blood pressure medications, yet there's a natural compound that works through a completely different mechanism, one that activates while you're sleeping. And the timing? That's the secret nobody talks about. Eating this at breakfast does almost nothing, but consuming it 30 minutes before bed? The results in clinical studies are frankly remarkable. Before I reveal what this food is, I need to know who's serious about their health today. Drop a comment telling me which city or country you're watching from. I personally read these because your location helps me understand what foods are available to you. And if you're tired of white coat doctors who only hand you prescription pads, hit that like button and subscribe. Let's get into this. Let me paint you a picture that's probably familiar. You take your blood pressure medication every morning, exactly as prescribed. Maybe it's a diuretic, maybe an ACE inhibitor, maybe a calcium channel blocker. You're doing everything right. But here's what happens in your body that most doctors never explain to you. Around 2 or 3 in the morning, when you're in your deepest sleep, something called the nocturnal dipping should occur. Your blood pressure is supposed to drop by about 10 to 20% during sleep. It's your body's natural repair cycle. But for millions of people over 60, this dip either doesn't happen or it's severely blunted. We call this non-dipping, and it's one of the most dangerous cardiovascular patterns we can observe. Why is non-dipping so concerning? Because while you're sleeping, your cardiovascular system should be recovering. Instead, it's under constant strain. This is why heart attacks and strokes occur most frequently in those early morning hours. Your vessels have been under pressure all night long when they should have been resting. Now, your daytime blood pressure medication? It's designed to work during your active hours. Most of these drugs peak in effectiveness 4 to 6 hours after you take them. By midnight, their concentration in your bloodstream has dropped significantly. This creates a gap in protection during those critical nighttime hours. But here's where it gets interesting, and frankly, where conventional medicine has missed the boat. There's a precursor molecule that your body converts into something called nitric oxide. You've probably never heard of it, but nitric oxide is perhaps the most important signaling molecule for vascular health. It tells your blood vessels to relax and dilate. And the conversion process? It happens most efficiently during the first 4 hours of sleep. The food I'm talking about is beetroot. Now, stay with me here. I know that sounds almost too simple, but the compound in beetroot called dietary nitrate is what we're after, and the concentration matters enormously. In clinical studies published in journals like Hypertension and the Journal of Nutrition, researchers gave participants about 250 grams of beetroot, roughly 1 medium-sized beet, or about 8 ounces of pure beetroot juice, 90 minutes before bed. Within 24 hours, they observed an average systolic blood pressure reduction of 4 to 5 points, with some participants seeing drops as high as 8 points. That rivals some prescription medications. But here's the mechanism that makes this so fascinating from a medical standpoint. When you consume beetroot, your saliva contains bacteria that convert the dietary nitrate into nitrite. This is why timing matters. You need to allow this conversion to happen, which takes about 30 to 60 minutes. Then, when you lie down and enter deep sleep, your stomach acid further converts that nitrite into nitric oxide, which is absorbed directly into your bloodstream. The nitric oxide then travels to the smooth muscle cells lining your arteries. It activates an enzyme called guanylate cyclase, which triggers a cascade that causes those muscles to relax. Your arteries dilate, blood flows more easily, your heart doesn't have to work as hard, and this entire process happens while you're sleeping, which is exactly when your body should be in that protective, dipping phase. Now I can already hear some of you thinking, but doctor, I'm on 3 different blood pressure medications. Won't this interact? This is actually the beauty of this intervention. Beetroot works through the nitric oxide pathway, which is mechanistically different from how ACE inhibitors, diuretics, calcium channel blockers, or beta blockers work. There's no pharmacological conflict here. However, and this is critical, I'm not suggesting you replace your medications. What we're doing here is supporting your cardiovascular system through a complementary pathway. Think of it like this. Your medications are working through the front door, and the beetroot is working through the side entrance. They're both helping, but they're not competing for the same receptor sites or elimination pathways. The only caution I give patients is this. If you're on medications and you add beetroot to your nighttime routine, monitor your blood pressure more frequently for the first week. Why? Because if your numbers drop too low, if you start seeing readings below 110/70 consistently, you may need to talk to your doctor about adjusting your medication dosage. That's a good problem to have, but it needs medical supervision. Let's talk about execution, because knowing this information is useless if you don't implement it correctly. You have two primary options: whole roasted beetroot or pure beetroot juice. I'm going to give you my clinical recommendation for each. If you choose whole beetroot, you want one medium-sized beet, roasted until it's tender. Don't boil it. Boiling leaches out some of the nitrates into the water. Roasting concentrates them. You can prepare several at once and keep them refrigerated for up to 5 days. Consume it about 60 to 90 minutes before bed. You can eat it plain, slice it into a small salad, or even blend it into a smoothie if the earthy taste bothers you. Some patients add a touch of balsamic vinegar and olive oil, which actually enhances absorption of the fat-soluble compounds. If you prefer juice, you need to be more careful. Most commercial beetroot juices are diluted with apple juice or other sweeteners that will spike your blood sugar before bed, exactly what we don't want. You're looking for pure, cold-pressed beetroot juice with no added ingredients. The dosage is about 250 milliliters, roughly 8 ounces. You can find this at health food stores or make your own if you have a juicer. A common mistake I see is people drinking this in the morning with breakfast and wondering why they don't see results. Remember, the conversion process and the nitric oxide production are optimized during sleep when your metabolic rate is lower and your parasympathetic nervous system is dominant. Morning consumption gives you some benefit, but you're missing the primary therapeutic window. Now, I need to address something that patients find embarrassing, but shouldn't. Your urine may turn slightly pink or reddish after consuming beetroot. This is called bituria, and it's completely harmless. It's just the pigment betalain being excreted by your kidneys. Don't panic and think you're bleeding internally. You're not. It typically clears within 24 hours. For the first 2 weeks, I want you to track 3 data points: your bedtime blood pressure reading, your waking blood pressure reading, and how you feel in the morning. Many patients report something unexpected. They wake up feeling more rested. This makes sense physiologically. If your cardiovascular system is under less strain during sleep, your sleep quality improves. You're getting deeper, more restorative rest. Let me take you slightly deeper into why this works so well specifically for people over 60, because understanding this will help you appreciate why consistency matters. As we age, our endothelium, the thin layer of cells lining our blood vessels, becomes less efficient at producing nitric oxide on its own. We call this endothelial dysfunction, and it's one of the earliest markers of cardiovascular aging. You might not have symptoms yet, but on a cellular level, your vessels are becoming stiffer and less responsive. The pharmaceutical industry's answer to this is prescription medications that force your vessels to respond through various mechanisms. And don't misunderstand me, those medications save lives. But what if we could also support your body's natural nitric oxide production? That's what dietary nitrate does. It provides your body with the raw material to produce nitric oxide when your own cells can't make enough. There's also emerging research on something called the nitrate-nitrite-nitric oxide pathway and its effect on mitochondrial efficiency. Your mitochondria are the energy factories in your cells, and they need oxygen to function. When your blood vessels are dilated and blood flow is improved, oxygen delivery to every cell in your body improves. This is why some patients report not just lower blood pressure, but better energy levels and cognitive clarity. The nocturnal benefit is particularly important for another reason. Arterial stiffness, which we measure clinically as pulse wave velocity, is highest in the early morning hours. This is why blood pressure tends to surge when you wake up. Your vessels are at their stiffest. By supporting nitric oxide production overnight, we're essentially pre-treating that morning surge before it happens. Now, I want to mention some secondary benefits that patients have reported, though I always tell people to focus on the primary goal first. Several studies have shown that the nitrate in beetroot can improve exercise tolerance. For seniors, this means activities like walking upstairs, gardening, or playing with grandchildren become less exhausting. The mechanism is that your muscles use oxygen more efficiently when nitric oxide levels are optimized. There's also intriguing data on cognitive function. Your brain consumes about 20% of your body's oxygen supply. When blood flow improves, cognitive performance can improve. Some older adults report better memory and faster thinking after several weeks of consistent beetroot consumption. We don't have definitive proof of causation yet, but the association is compelling. Beetroot also contains betalains, which are potent anti-inflammatory compounds. Chronic inflammation is a major driver of cardiovascular disease, so you're getting a 2-for-1 benefit here: improved nitric oxide production and reduced systemic inflammation. One patient of mine, a 68-year-old woman who'd been on 2 blood pressure medications for years, started eating roasted beetroot before bed consistently. After 6 weeks, her morning readings had dropped from an average of 145/88 to 128/78. Her cardiologist was able to reduce one of her medications by half. She tells me she feels like she's aging in reverse. Now, that's one case, not a clinical trial, but it illustrates what's possible. I need to give you a few medical cautions because I take your safety seriously. First, if you have a history of kidney stones, particularly calcium oxalate stones, you need to be careful. Beetroot is high in oxalates, which can contribute to stone formation in susceptible individuals. Talk to your doctor first. Second, if you're on warfarin or another blood thinner, the vitamin K content in beetroot greens, not the root itself, can interfere with your medication. The beetroot itself is fine, but avoid eating large amounts of the leafy greens. Third, if you have gastroparesis or severe acid reflux, consuming beetroot close to bedtime might aggravate your symptoms. In that case, move your consumption window to 2 to 3 hours before bed instead of 30 to 60 minutes. And finally, if you're diabetic, monitor your blood sugar response. While beetroot has a low glycemic index, everyone's metabolism is different. Most patients see no issue, but it's worth checking. Here's what I want you to do tonight. Not tomorrow, not next week. Tonight. Go to your grocery store or pull out whatever you have in your kitchen. Get 1 medium beetroot. Roast it with a little olive oil at 400 degrees for about 45 minutes until it's tender. Let it cool. About an hour before you typically go to bed, eat that beetroot. Take your blood pressure right before you eat it, write it down, and then check it again when you wake up tomorrow morning. Do this consistently for 14 days. That's 2 weeks. I'm not asking for a lifetime commitment right now. I'm asking for 14 days of data collection on your own body. Keep a simple log: date, bedtime reading, wake-up reading, and a note on how you slept. At the end of those 2 weeks, look at your numbers. If you see even a 3 to 4 point reduction in your average readings, you've just discovered a tool that costs less than $2 per day and has 0 side effects for most people. I want to hear from you in the comments. Tell me, are you going to try this tonight? And for those of you who've already been doing something similar, share your results. This community learns from each other, and your experience might be exactly what someone else needs to hear to take action. If you found this information valuable and you want more evidence-based health strategies that actually work for people over 60, subscribe to this channel. We don't do pharmaceutical promotion here. We do real science explained in plain language that you can act on immediately. The goal of everything I share with you is not just to help you live longer, but to help you live better. Lower blood pressure isn't just about the numbers on a screen. It's about reducing your risk of stroke, heart attack, kidney disease, and dementia. It's about being here for your family, maintaining your independence, and enjoying the years you've worked so hard to reach. 1 beetroot before bed. That's your assignment. It's not complicated, it's not expensive, but the science behind it is robust, and the potential benefit is significant. In our next video, we're going to talk about the 3 common foods that are secretly destroying your blood vessel health, even if your doctor says they're heart healthy. You don't want to miss that one. Until then, take control of your health, one small decision at a time.